So let us record the lecture also. So what do you people know about the ninth cranial nerve? First of all, the ninth cranial nerve is one of the cranial nerve which has all of the four functions which can be carried by a cranial nerve. So the first function, yes, majorly, the major function of the ninth cranial nerve is special sensory. Number one, it is special sensory. And the special sensory nucleus is again composed of three parts which we drew in the fifth nerve. You remember it? That one which had three parts. Do you remember the name of the parts?
Mesencephalic, spinal, and
Spinal tract part, mesencephalic part, and the principal part. Principal part. The topmost one was the principal part. Here was the mesencephalic part. Sorry. Then was the larger dilated part, which was the principal part, and then the longer one, which went into the spinal cord, which was known as the spinal tract part. So now I do not think we have to label it. However, we may write this was the mesencephalic. The next one was the principal part.
Principal.
And the last one was the
spinal
tract part. Okay. Now, it is majorly sensory. Now, the second function, does any one of you know? It is motor. And the motor nucleus of the ninth cranial nerve, does any one of you know the name? It is a small nucleus present anteriorly in the medulla. Its name is nucleus ambiguous. What is the name? Nucleus ambiguous. So nucleus ambiguous is actually the motor nucleus of the glossopharyngeal nerve. Now, is it parasympathetic? चले पहले आते हैं. Is it special sensory? Does it carry special sensory system? The answer is yes. And what is the special sense which it carries? It is taste from the posterior 1/3 of the tongue. And this is the nucleus for it. And the name of this nucleus which carries taste was tractus solitarius. Tractus solitarius, yeah. Solitary tract nucleus भी इसको हम कहते थे. So there is one nucleus left, which is obviously the parasympathetic function. We can draw it in orange color, the parasympathetic function. The parasympathetic function is what is the parasympathetic function of the glossopharyngeal nerve? Anyone tell me?
सर lacrimal gland को देती है ये.
Salivation.
Yes, it is obviously very good. It is. Let me move it a bit. Just a second.
Inferior,
because the space is limited. Okay. The nucleus which carries parasympathetic supply, the parasympathetic supply is delivered to the parotid gland. The parasympathetic supply is to the parotid gland through a branch which we yesterday just talked about. The name of that branch was lesser petrosal. Excellent. And the name of the nucleus was inferior salivatory. So now we can write here the number third function is what? Special sensory, which is obviously taste. And the number fourth function is, please say it is parasympathetic, which is obviously delivered to the parotid.
सर फिर वन वाला जनरल सेंसरी है
जी, obviously. Oh, sorry.
वन वाला जो ग्लैंड है वो.
Okay, sorry. It's a typing mistake. Sorry. It is general sensory, the first one. Sorry. Yes, excellent. Just picked it out in a hurry. It is general sensory. This is the general sensory nucleus, which we all know, which had 3 parts. Sorry. It is general sensory. Sorry. Now, the nerve emerges from the ventral aspect of medulla lateral to the olives. Where does the nerve emerge? The nerve emerges lateral to the olives from the superior aspect of the medulla, from here somewhere. It moves forwards and it gives 2 swellings. Does any one of you know the name of the swellings which it gives? Anyone? Superior ganglia and inferior ganglia. These ganglia have no function, no doubt. And then it emerges through a foramen. What was the name of the foramen through which the glossopharyngeal nerve emerged out?
Jugular foramen.
Jugular foramen. From the jugular foramen, the 9th nerve, the 10th nerve, and the 11th nerve emerged out, and it moves down. And point here, we can draw it as well. The jugular foramen. When it is passing through the jugular foramen, it is actually giving these swellings like this. Okay. So what is the name of the foramen? The opening, which is an important question always. This is the jugular foramen, and to be precise, the central component of the jugular foramen. Anterior से क्या गुजरता था? What structure passed through the anterior component? It was the inferior petrosal sinus, and from the posterior was the sigmoid sinus, which used to fuse and form the internal jugular vein. So the jugular foramen, they pass out. Now, as the nerve moves down, it loops around a muscle named as stylopharyngeus and gives it a motor supply. So here, somewhere here, there is a muscle which is known as stylopharyngeus. What is the name of this muscle? Repeat. Stylopharyngeus, and it loops around it and moves ahead by giving a motor supply to the muscle. So we can make a nerve supply in red color, which is obviously arising from a nucleus, which was the nucleus ambiguous, and this nerve is supplying the muscle. Afterwards, when it reaches this point, it gives a large plexus, a large general sensory plexus, which is known as the pharyngeal plexus. What is it known as? The pharyngeal plexus. And as we are drawing the pharyngeal plexus in a blue color, obviously it means it's a general sensory sort of a plexus, pharyngeal plexus, which will carry sensations from some areas of the pharynx, and I'll write it afterwards. I'll tell you afterwards. Then it gives a branch which is known as soon as it emerges from outside the jugular foramen, it gives a branch which is parasympathetic, and it moves somewhere like this, goes up and then forwards, and it will end in a ganglion which was known as the otic ganglion. And what should be the name of the nerve?
Lesser petrosal nerve.
Lesser petrosal.
Very good. Now look, you know it from the previous knowledge, and this nerve is obviously the lesser petrosal. So we have completed 2 major functions. The parasympathetic function is done and the motor supply is done. This is the only motor supply, this is the only parasympathetic function. Now, in the pharyngeal plexus, let us finish the special sense, which I mean to say the taste as well. In the pharyngeal plexus, it gives a branch which goes towards the tongue, and we may color it not in only blue but also in a green color, because this nerve carries dual functions, and it will be entering the posterior 1/3 of the tongue, and it will carry general sensations. What will it carry? The general sensation, like pain, touch, itching, temperature, vibration, each and everything, general sensations from from, repeat, posterior 1/3 of the tongue, and I may change the color into green, which designates the taste or the special sensation. So it also carries taste from posterior 1/3 of the tongue. So done with it. Now there is one important branch which you should never miss, which you should never ever miss. This is the nerve of herring. Do you remember what was the nerve of herring I taught you earlier? At the start of the pharyngeal plexus, there is a nerve which goes down into the neck in the carotid sheath to reach a structure. What was the name of the structure? Shabash, anyone? Will you like to tell me?
Baroreceptors.
If you do not remember, yes, very good. If you do not remember, let me draw it like this. There was an artery, the major artery of the neck, which was the internal carotid artery, which used to bifurcate into two branches, the external and the internal, and there was a body in between the bifurcation. It was known as the carotid body,
Carotid body.
which was a chemoreceptor, and there was a dilatation at this point, which was known as the carotid sinus, and obviously it was a baroreceptor. So this nerve of herring, which is also known as the carotid branch of glossopharyngeal nerve, not only supplies the carotid sinus, but it also supplies the carotid body. So what is this? The yellow one is the carotid body, and it is the afferent nerve, the sensory nerve to these areas. The carotid body and the dilatation, which is known as carotid sinus, which is a baroreceptor or a plesioreceptor. So I guess, are you all clear about it? I hope so. This dilatation is the carotid sinus, and this yellow one, the yellow thing, it is the carotid body. And what is the name of the nerve? Tell me. Tell me kindly.
Nerve of hearing. Nerve of hearing of glossopharyngeal.
Nerve of herring, or we can simply say carotid branch. It is again, it has two names, carotid branch of glossopharyngeal nerve. Now, what does this pharyngeal plexus do? Will any one of you tell me? What does this pharyngeal plexus do? It carries general sensations. It carries general sensations from where? Carries general sensations from any one of you, from the pharynx,
Pharynx.
especially, I may write it, especially, sorry, the E is missed, especially from the naso and the oropharynx, not from the laryngopharynx. Not from the laryngopharynx, because from the laryngopharynx, the major sensations are carried by the vagus nerve, okay? And when you write the oropharynx, remember one thing, there is a very, very important surface or a structure in the oropharynx, which is the palatine tonsil. So it also including, so if a patient is having pain in the tonsils due to acute tonsillitis, which will be the nerve? Which will be the nerve?
Glossopharyngeal.
Glossopharyngeal. So this is all we should know about the glossopharyngeal nerve. It is very, 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 very simple. So anyone who has a question?
सर आपने दो स्पेलिंग्स की
सर
बात
ब्लू
की
कलर
थी
में आपने गैंग्लियन बनाए हैं दो
Yes, the larger, the upper one is known
कौन से
as the superior glossopharyngeal ganglion, and the lower one is known as inferior glossopharyngeal ganglion. They are general sensory ganglia. You just should know it. They are general sensory ganglia. That's all. You should know nothing more. Now, should I show you this image from the atlas also? So you may get a good idea. The plate is somewhere at plate 1.
सर ये नर्व ऑफ हेयरिंग भी कैरोटिड शीथ के अंदर होगी.
Yes, obviously it will go inside the carotid sheath. Otherwise, how can it supply the carotid body and sinus? Now look. If you see here, can you see the structures? What was the color? What was the color of the general sensory nucleus which we made? It was blue. Am I right? So look, spinal tract and spinal tract nucleus of trigeminal nerve. What was the color of the spatial sense, the taste? It was green.
green.
This one, the solitary tract nucleus. What was the name of the color of the motor nucleus? Ambiguous. It was red, I guess.
Red.
Yes. And what was the parasympathetic one? It was orange in color.
Orange.
This here. This is here. Sorry. The inferior salivatory nucleus. And now, inferior salivatory nucleus is giving this nerve, lesser petrosal nerve, which is going into a ganglion, which is known as the aortic ganglion. Can you see? Just after emergence, this nerve comes out like this from the ganglia, in fact. Now, where is the motor supply? Motor supply is to the stylopharyngeus muscle and branch. Can you see it here? The only motor supply of this nerve is stylopharyngeus. Now, the one which we drew in the green color, the solitary tract nucleus, taste and general sensations from the posterior one-third of the tongue through this branch, which is lingual branch, this one. Okay, and the ones in blue, we made the pharyngeal plexus. Where's the label of the pharyngeal plexus? Now look here, this is the pharyngeal plexus. This is the nerve of pharynx, which is the carotid branch of glossopharyngeal nerve. And I just told you that the nasopharynx, tonsil, and the oropharynx is the major area supplied by it. Now look, if this area, this is the area which is behind. Now this area, this is the larynx, and this area is behind the larynx, and it is known as the laryngopharynx. It is obviously being supplied by another nerve, which is pharyngeal branch of the, now look, what is it? The vagus nerve, the 10th nerve, which we will study in the next coming minutes. Got it? Should I stop or should I proceed? Any question up till now?
सर अगर कोई ब्रांचेस पूछे ग्लॉसोफ्रेंजियल की तो हम कौन कौन सी बताएंगे? एक तो लेसर पेट्रोसल नर्व और नर्व ऑफ
Now look, the question you are asking, it is a very vague question. Now look, why will someone ask me what are the branches of glossopharyngeal nerve in an exam based on an MCQ pattern? No one will ask me the name of branches. They will, yes, they can ask what the major the parasympathetic branch of the glossopharyngeal nerve is. Obviously, lesser petrosal. The special sensory is the lingual. The motor is the nerve to stylopharyngeus muscle. The general sensory plexus is the pharyngeal plexus. The general sensory nerve to the carotid body and sinus is the nerve of pharynx or the carotid branch of glossopharyngeal nerve. So it will be like that. They will ask a single thing, not all. And the nuclei may be asked, obviously. So, any other confusion?
सर आपने दो स्पेलिंग्स की बात की थी कि जब नर्व इमर्ज होती है दो स्पेलिंग्स देती है.
Now look there. These are the swellings. This is the superior ganglia. This one is the inferior ganglia. You can study the labels. You can see the labels. Superior and inferior ganglia of the glossopharyngeal nerve. They and you can see a synapse, small synapse, bipolar neurons. Wala. This is the blue dot. This is the sensory ganglia. You should know nothing else. It's just a general sensory ganglia. There's no specific.
सर अब जो ब्रांचेस हमने की हैं इनमें स्टाइलोफ्रिंजेस वाली जो है ओनली मोटर वही है, उसके अलावा सब सेंसरी हैं, बस यही बात.
One is motor, one is general, one is motor, one is special sensory, one is parasympathetic. Remaining all are general sensory. Now look here, go back. Let us go back. Let us go back on that figure. Now look here. How many branches do we have in an orange color? Only one. One parasympathetic. In green color, only one. Special sensory, lingual. In red color, only one. Stylopharyngeus. Only motor. The remaining all branches are in blue color. That's all. So, any confusion? There is one thing more you have to remember here. Let me draw it. Let me draw it. This is also a question that is sometimes asked. Although this is a blue nerve, orange nerve, which means it is parasympathetic, it also carries some blue colored fiber. What does these blue color fiber designate? They designate general sensory function. As this nerve is going upwards, it gives a few branches to a specialized thing here somewhere, which is known as the tympanic membrane. To what? To the tympanic membrane. What is the thing which we drew in light blue color? It is the
Panic
tympanic
membrane.
membrane. This is an important thing to remember. And these blue fibers, they form a smaller plexus on the tympanic membrane, which is known as tympanic plexus, and they carry general sensations from the inside of the tympanic membrane, not the outside. The outside of the tympanic membrane, from the outside of the tympanic membrane, the general sensations are carried by the 5th and the 10th nerve. Remember my words. From the exterior of the tympanic membrane, the outer side, which is facing towards the external ear, the general sensations are carried by the 5th nerve and the 10th cranial nerve. However, from the inner aspect of the tympanic membrane, which is facing the middle ear cavity, the general sensations are carried by the tympanic plexus, which goes into the 9th cranial nerve. So, is it clear?
सर एक दफा रिपीट कर दें.
What should I repeat?
एक्सटर्नल और इंटरनल वाले जो आप बता रहे थे.
The outer surface of the tympanic membrane, general sensations are carried by the 5th nerve and the 10th nerve. However, from the inside, the sensations are carried by the, now repeat, from the 9th nerve. So, are you sure now? Now look, like this. So by here, we finish or complete this nerve. So all of these nuclei contribute to the nerve and they supply, and that is all. So is it simple? Any questions?
Yes, sir. No.
Anyone else? Please be open. Please do ask. No one?
Sir, can you repeat the tympanic membrane part?
Okay, I will repeat. Why not? Amar, I'm saying, okay, we have a message here. Just a second, we see. Yes, okay, clear. That's good, Dr. Ikra. Okay, I said the tympanic membrane has two surfaces. One is the surface which is facing towards the outer ear, that is the external surface. One surface is facing towards the middle ear cavity, which is the inner surface. From the outer surface, the general sensations are carried by the 5th nerve and the 10th nerve from the outside. From the inside, by the 9th nerve. So it will definitely carry from the inner aspect or the medial surface of the tympanic membrane, which is facing towards the middle ear cavity. Now are you clear?
Okay, sir.
Okay.
Yes, sir. Thank you.
So we'll take a 2-minute break, not more than that, just a 2-minute break. We'll continue afterwards to the 10th nerve.